Can you imagine the terror of knowing that you've been infected with the strange bacteria that slowly eats away your flesh? Thought of your own flesh rotting away must be absolutely horrifying. Plus, the scary little detail that if you survive, the infection can leave you permanently disfigured or disabled for the rest of your life. Vibrio vulnificus. The name alone is enough to send chills down the spines of medical professionals and the public alike. This rare flesh-eating bacteria is notorious for causing a deadly infection that can literally eat away at your flesh. Vibrio vulnificus is a rare and potentially deadly bacteria that can cause devastating infections, including sepsis, severe wound infections, and stomach flu. It's a halophile, meaning salt-loving, and was first identified as a source of disease in 1976 by researchers at the Centers for Disease Control and Prevention.
An urgent news warning about swimming in salt water and eating raw shellfish. Officials have announced 3 deaths in recent weeks, 2 in Connecticut and 1 in New York from vibriosis.
After 3 fatalities were linked to bacteria that lives in water, health officials in the U.S. were frightened and declared openly that 3 deaths in recent weeks, which included 2 persons in Connecticut and 1 in New York, were the result of ringworm, a rare infection sometimes brought on by eating raw infected shellfish, which includes oysters, clams, and scallops, or being in salty or brackish water. Both Connecticut residents had open wounds, sores, or recent injuries from the actions that most likely caused the disease. Before we go on to talk about the deadly effects of this bacteria, let's first find out the causes of such a bacteria that is highly threatening. Vibrio vulnificus is one of the most dangerous bacteria species that causes vibriosis. It only takes a few hours for it to move from your intestines to your blood and other organs during the brief incubation phase. It can be found in warm, saltwater coastal areas and between the months of May and October.
Experts say the number of cases of vibriosis have increased over the years, likely due to warming coastal waters where the bacteria thrive.
More infections typically occur. Vibrio cases have unfolded over time, according to professionals, which is likely due to warming coastal waters where the bacteria thrive. This is usually a terrifying time of year for people who live in or visit coastal areas, as they're at a higher risk of contracting the infection. One of the primary causes of Vibrio vulnificus infections,
Eating raw, infected shellfish, including oysters, clams, and scallops,
is the consumption of raw or undercooked seafood that has been contaminated with this bacterium. So, if you're a fan of raw sushi or oysters, it's important to be aware. But how exactly is Vibrio vulnificus transmitted? Well, it can penetrate the human body through open wounds or by eating up contaminated seafood. If you have any cuts or bruises on your skin while handling raw seafood, you might be at risk. Additionally, waterborne infections can occur when individuals swim in warm seawater or brackish water that harbors Vibrio vulnificus. If you're still with us, thank you. Don't be afraid to subscribe to our channel so you can see more content exactly like this. And please, don't be afraid to give us a thumbs up. When it comes to Vibrio vulnificus, recognizing the symptoms is crucial for early detection and prompt treatment, which may vary. These symptoms may include dangerously low blood pressure if the bloodstream has been infected, watery diarrhea that's usually followed by a combination of stomach cramping, nausea, vomiting, severe pain, swelling, redness, blistering around a wound or cut, and fever, or all of the above, according to the CDC. If left untreated, these symptoms can quickly escalate into necrotizing fasciitis, a condition where the bacteria rapidly destroys soft tissues. The flesh-eating bacteria, Vibrio vulnificus, can be devastating. Many people who are infected with it require intensive care or limb amputations in order to survive. And for some, the consequences are deadly. According to the CDC, 1 in 5 patients with this infection dies, sometimes just a day or 2 after becoming unwell.
And doctors say people with compromised immune systems should be careful eating or handling raw seafood.
People with compromised immune systems are especially vulnerable to Vibrio vulnificus infection. Bacteria can be devastating, even fatal for these individuals. Anyone can be infected, but those with liver disease, cancer, or a weakened immune system are at a greater risk. Want to know what's even more absurd? Sometimes, even after taking medicine to decrease stomach acid levels can increase the chances of infection. In order to successfully examine the indications of vibriosis illness, or to attempt to cultivate germs from the sample of a person's blood, bodily fluids, or tissues, samples are taken by the doctor to determine whether such a person has been infected and are further sent to the lab. They could examine samples of your blood, feces or stool, sputum, or lung mucus that you cough up, and fluid or tissue taken from a wound. If you believe you may have eaten raw fish or come into contact with seawater, be careful to inform your healthcare professional. Your healthcare provider can begin treating you for a Vibrio vulnificus infection before test results are returned, since you could quickly have major problems. When it comes to consuming raw or undercooked seafood, it's crucial to know the source. Choose from a reputable supplier who adheres to proper handling and storage protocols. Additionally, ensure that seafood is properly cooked before enjoying it, as heat kills bacteria like Vibrio vulnificus. But what about water safety? Whether you're swimming in the ocean or enjoying recreational activities in lakes or rivers, it's essential to follow water safety guidelines. Avoid swimming in warm, brackish waters if you have open wounds or cuts, as they provide an entry point for bacteria. If you do have any cuts or wounds, make sure they're properly covered with waterproof bandages before entering the water, and wash the wound with soap and water after swimming. People with skin infections may need surgical debridement, where a provider cleans dead tissue out of their wounds. This can be a painful and unpleasant procedure, but it's necessary to remove the dead tissue and prevent the infection from spreading. The New York State Department of Health has urged healthcare providers to take into account whiplash when diagnosing wound infections or sepsis of unknown origin. Additionally, practicing good hygiene habits, such as washing hands thoroughly with soap and water after handling raw seafood, can greatly reduce the chances of infection. It can also be relieving that the infection, when caught early on, can be treated with antibiotics such as the following: doxycycline, cefzidime, cefotaxime, and ciprofloxacin. By understanding the risks associated with this bacteria and implementing preventative measures, we can protect ourselves and our loved ones. If you think you've been infected with Vibrio vulnificus, it's important to remember the time is of the essence when dealing with Vibrio vulnificus infections, hence the need to seek medical attention immediately, knowing that the sooner you get yourself treated, the better your chances of survival. If you found the information in this video educational and fascinating, then I've done a good job. My goal on this channel is to bring you highly educational health information. And if you like this video, then you'll like other videos just like this one on our channel. Follow the prompt on your screen right now to watch the next educational and entertaining health video on our channel. And while you're doing that, remember to subscribe to the channel if you're new here and give us a thumbs up so that we know we're doing a good job. And, as always, thank you very much for choosing to spend your time with us today. We'll see you in our next video.